Okay, great. So now I'm going to put the laser pointer. All right. So hello, everyone. Again, my name is Ethan Ramirez, and I am a second-year medical student at the University of South Florida, Morsani College of Medicine in Tampa. And my project that I'm presenting to you all today is about Kratom, and it's a legal review on Kratom in America. So before we dive into it, I just would like to introduce everyone to Kratom because Kratom isn't really a substance that most people actually know about unless you live in Southeast Asian nations. So Kratom, the scientific name is Mitragyna speciosa. It is actually traditionally in Southeast Asia and other nations for thousands. The effects were claimed to be opioid-like in nature. And recently, modern research within the past 5 years has actually elucidated that Kratom is in fact, or does in fact contain active alkaloids similar to traditional prescription opioids, and it is actually a psychoactive, psychogenic substance similar to the prescription opioid. Now, again, because Kratom was originally, I guess, discovered and used for thousands of years in Southeast Asia, I'll talk about some of the Asian Kratom laws and then translate that into the current legal status of Kratom. Actually made Kratom sale, purchase, and consumption illegal in 2013. And this is essentially right around research was able to discover these actual alkaloids within the Kratom plant that in fact give it these opioid properties. This banning of Kratom in these Southeast Asian nations is very, I guess you could say, differently regulated depending on which nation you're in. So for example, in Indonesia and Vietnam, where Kratom has quote unquote been banned, they actually remain some of the largest manufacturers and distributors of Kratom. And then meanwhile, in other countries such as in Thailand and Malaysia, they strictly enforce their Kratom legislation, and any, I guess, use of Kratom or manufacture or distribution can result in up to 4 years of prison time. So this sort of legal disparity in how the laws are enforced in Southeast Asia really does translate over into America, because as you can see by this map I made here, out of all 50 states, there's a wide variety of different legal statuses when it comes to Kratom. So I'll first start off by saying federally, Kratom is not regulated by the federal government. And that's not to say that the federal government does not have an opinion about Kratom. And that's not to say that the federal government hasn't taken action against Kratom in the past, but currently within the US legislation, there is no federal rulings. This is in opposition to state laws, and that's why you see this variety of colors I have here, is that the state laws differ quite a bit. So to break this map down, the dark green colors represent states where Kratom is legal, and it's mainly legal because there's just never been any proposed legislation to support it or ban it. It just hasn't really been addressed, therefore it's legal. And that's most of the states that you see here. And then some of the other states where Kratom is legal would be these blue states. And those represent states that have actually passed legislation that regulates Kratom sale, distribution, manufacture, and consumption for its citizens. This legislation is typically called the Kratom Consumer Protection Act, and I'll get into what that is in a little bit. And these blue states with the striped lines, those simply represent states that have pending legislation to regulate Kratom within their state. Now, in opposition to that, you see these red and orange colored states here, such as Wisconsin, Michigan, Indiana, Arkansas, and Alabama. And these passed legislation that bans Kratom. Now, the method in which they ban Kratom tends to differ between each state. Most states add Kratom to their own State Controlled Substances Act as a Schedule I substance. This is not the case in every state. And then these orange states represent states that have pending legislation to ban Kratom. And again, they, the way in which each state goes about wanting to ban Kratom does differ quite a bit. So for example, in Hawaii, when they plan to ban Kratom use as it currently stands, they are going to make it a Schedule V controlled substance, whereas a state such as New Jersey here would intend to make it a Schedule I controlled substance, which is of course the highest level of control, and it's in categories, or it's other drugs within this category are certainly illicit substances that are illegal to possess or use in this country. We see such a huge variation in Kratom legality, and what I alluded to before is that why do we have such variation? What's the purpose for this? And one reason, of course, is that it is actually an opioid. And as you can see in this figure I have down here, this just kind of shows how Kratom, the alkaloids in Kratom, which are actually called metragenine and 7-hydroxymetragenine, are active alkaloid compounds that act as partial agonists on the mu-opioid receptor, which I'm sure all of you addiction medicine experts are quite familiar with. And however, and then this causes the activation, and that gives you the analgesic, antidepressant effects that you see with opioid use. Now, Kratom seems to be a little unique in that its mechanism is what you would call a biased activation, where it seems to only really partially activate those G protein signaling mechanisms that lead to its analgesic effects, but it actually doesn't strongly initiate beta-arrestin signaling, which is associated with some of the negative effects of opioid use, such as respiratory depression. So Kratom actually does seem like a substance that would prove to be as effective as traditional prescription opioids, and possibly safer than traditional prescription opioids if it was properly, again, researched and regulated. The problem is that Kratom is available without a prescription. There is very little research on Kratom at the moment. So it's, I guess you could say that the state of Kratom is very unsure as to how it should proceed with using this plant moving forward. Now, some of the local state reasons for why they've decided to all can be seen in this column. And these rationales would include the opioid crisis, which until recently with COVID-19 was one of the most major issues in America, in addition to lobbying efforts by pro-Kratom organizations, citizen illness reports, and unfortunately citizen fatality. So when it comes to the opioid crisis, I'll point out a state such as Alabama in particular. Alabama has struggled greatly with prescription opioid abuse within the past decade. And a 2018 study actually showed that there were 1.21 prescriptions for opioids prescribed to every man, woman, and child within the state of Alabama. Now, obviously, this isn't actually feasible, so it just goes to show how much opioid prescribing was going on and how much opioid abuse potential there was in a state such as Alabama. And as such, very early, I believe in 2016, which is actually early because, again, Kratom is so new in this country and its understanding is very new. And Alabama and similar states such as Arkansas and Indiana, when they have banned kratom, they have actually put forth verbiage in their state legislation that has made this ruling irreversible. So kratom is to remain banned within these states, regardless of any future legislation. Now, again, to contrast that, we have lobbying efforts by pro-kratom organizations. These include companies such as the American Kratom Association, and their mission is to ensure that kratom remains legal in America and also promote proper regulation of kratom to ensure safety for citizens who use it. Now, the legislation that this organization has particularly been pushing is called the Kratom Consumer Protection Act. And you can look this up online, and essentially it's just an act that lays out assurance that promote quality assurance for all kratom products that are sold within that state. So that is certainly one rationale, is that these lobbying organizations have been working quite hard, as you can see in these blue states such as Indiana, Kansas, New York, and Ohio. They've really been pushing to pass the Kratom Consumer Protection Act, and they want to do it in as many states as possible. Now, another rationale for the current legal status of kratom would be citizen illnesses related to contamination. Like, as I said previously, kratom is not federally regulated, and therefore it does not fall under the onus of a federal organization such as the Food and Drug Administration to enforce quality assurance and contamination testing of these products. And as such, there's incidents such as actually had to step in and conduct an investigation because so many patients were coming down with severe salmonella infections, and it was revealed that over 6 unique strains of salmonella were identified in over 65 different kratom products that were shipped throughout America. And this led to over 400 people becoming so sick with salmonella infections that they actually required hospitalization. So that's obviously paints a negative perspective of kratom in many of these states, and it is cited in some of these states that have banned kratom as a reason for banning it, because it's simply not a safe substance as it currently stands. And then finally, one of the more tragic reasons why we see kratom legislation disparity is citizen fatality. So in states such as Arkansas, and then cities specifically such as Denver, Colorado, there have been forensic pathology reports that have shown an increased number of citizen fatality in which kratom was found in their system. Now, I will note that in a majority of these cases, there was poly drug abuse involved, and kratom was not the sole substance found in these victim systems. Instead, there was a mix of other illicit substances, including alcohol, heroin, benzodiazepines, and traditional prescription opioids. So kratom cannot be determined to be the sole cause of mortality in these individuals, but nonetheless, it was involved in these fatalities. And as such, many separate municipalities have decided to ban kratom, even in opposition to their own state law. So I'll point out these little red dots here on the map. These are all areas in America that have decided to ban kratom, even though their state has no legislation that bans kratom. They just decided to take it upon themselves to do that. Illinois and Mississippi in particular have many different areas that have decided to do this, even though they are kratom legal. And so now I'll discuss some of the implications of this policy disparity. And I'll focus on 3 main populations. That would be the consumer population, healthcare professionals, and national and state legislators. So I believe, the implications of this legal disparity of kratom on consumers is somewhat obvious. And again, that without the proper public awareness of kratom, consumers are actually more likely to abuse kratom. They're more likely to use kratom in addition to using other substances because they don't know about any possible synergistic effects that may occur. Because again, most of them are unaware that kratom is even an opioid. Lack of regulation, consumers are at an increased risk of kratom adulteration and contamination, which we had already discussed with the salmonella outbreak. And it hasn't really been confirmed yet, but because of a lack of quality control, it doesn't seem out of the realm of possibility that certain kratom manufacturers would adulterate their kratom with actual synthetic opioids, such as fentanyl, to increase effectiveness and possibly, try and create a more loyal customer base. Now, in terms of the healthcare community, this legal disparity on kratom is really detrimental to healthcare professional education and awareness about kratom. Because this is a virtual conference, but I'm sure a majority of you were unfamiliar with kratom, and that's just the reality of the situation. And in states such as Arkansas, where kratom is banned, a healthcare professional is likely to receive no education or really have any knowledge about kratom, what it is, and how it should be handled. And therefore, they really can't advise their patients who might use kratom on how to use it safely, or really some of the potential dangers about kratom. Meanwhile, right next door here, we have Oklahoma, where kratom is actually legal and on top of that regulated. And you could easily see a disparity where healthcare professionals in Oklahoma may know quite a bit about kratom and may have patients who actually self-prescribe kratom, and they might know more about it than, say, their colleagues in Arkansas. And that just creates a huge amount of disparity in healthcare knowledge overall, certainly in America, and then of course globally as well. And then finally, the national and state legislators, as you can see, this kind of shaky foundation, this legal foundation that kratom policy has been built upon, really has negative effects in terms of likely that the government will want to fully legalize and regulate kratom, seeing that 6 states have already passed legislation that bans it irreversibly. And as such, you won't see kratom used in these states, even if future research elucidates all of its positive pharmacological benefits and actually can regulate kratom as a prescription opioid that's actually much more effective and much safer than the current opioid medications that are being prescribed. But again, these states just simply won't have access to that medication if it is created because of the legislation they have put in place. So that essentially wraps up this legal review of kratom in the United States, and then some future directions to research and review the kratom legislation, as it is very fluid and these rulings change all the time. I'd actually like to point out these purple states here. These represent states that have pending legislation to both ban kratom and pending legislation to legalize kratom. So these 2 states really can't make up their mind on the situation. And essentially, it could be banned in these 2 states or legalized in these 2 states anytime now, as the legislation is just sort of sitting in Congress. Another future direction would be to study some consumer perspectives on kratom, maybe with survey studies, just to understand